I want to thank everyone for tuning into this video. It's a video about dental health. Kind of just wanted to present to pet owners kind of basic anatomy, development of the teeth, talk about what I do for teeth, how I try to prevent disease, treat disease, and also some of the diseases themselves. In this first slide, we're going to start breaking down anatomy of teeth, development of teeth. And so we're looking, we see that puppies and kittens are born without teeth, and then starting at 3 weeks of age, all the way up until about 12 weeks of age, those primary teeth, of that first set of teeth, are going to start to form. Puppies are going to have 28 primary teeth, and kittens are going to have 26 primary teeth. So after those primary teeth are done developing, at about 3 months of age, those primary teeth are going to start to fall out, and adult teeth are going to start to develop and come in. So just like us, dogs and cats have 2 sets of teeth that they'll have during their life. And those baby teeth, those primary teeth, will finish falling out by 6 months of age, and the adult teeth will be grown in by 6 months of age. Dogs are going to have 42 teeth. They have a full set of teeth, and cats are going to have 30. So this next slide shows us about dental anatomy, about kind of what things you're going to see in the mouth. So when you lift up the lip, one of the first things you may see is the gums or the gingiva. It's kind of the soft stuff. It's maybe red or black or a mix of color in the dog or cat's mouth. And this stuff is there to cover the bone, to help protect the socket that the tooth sits in. And then you're going to see, of course, the tooth itself. You're not going to see, but you're probably going to feel, is the bone that all the tooth sits in. The jaw bone, or also the alveolar bone is what it's technically called. And then something you're not going to see, but is very important for the mouth, is the periodontal ligament. And on the diagram you'll see that it's that kind of light blue tissue that is between the jawbone and the tooth. And what this tissue is it does 2 things. First off, it holds the tooth in place. And secondly, it provides like a cushion. So when they bite down on something, when they chew on something, that tooth is not ramming into the bone. It's actually kind of hitting that connective tissue cushion to help cushion that blow. And that periodontal ligament is tough, very hard. That's what keeps those teeth in there so well. Now we're going to start breaking down the tooth itself. So the tooth is divided into 2 kind of parts. The first part is the crown, and that's everything that exists above the gum line, the part that you can see. And then you have the root, and that's what's below the gum line. The tooth itself is divided then into 3 layers of tissue. You have the enamel, which is the hard outer covering, very smooth, very hard, actually the hardest substance in the body, but very brittle, easy to chip, easy to crack. Under the enamel you have dentin, and dentin is hard, but dentin is filled with microscopic holes or tubules, and this is actually what makes like a sensitive tooth. If someone maybe has thin enamel or has enamel that's missing, the dentin is what actually carries that hot and cold sensation down into the pulp of the tooth, the center of the tooth, where the nerve and the blood vessel live. Now, plaque is something that you hear dentists talk about, you hear on commercials about teeth and about brushing, and you'll hear me talk about a lot when I talk about dogs and cats and dental issues. And so maybe actually go, well, what is plaque? Why do I need to worry about it? Well, plaque is an accumulation of bacteria and proteins on the surface of the tooth. And the amount of bacteria is actually quite staggering. When you look at 1 milligram of plaque, it has over 10 trillion bacteria in it. And this is why plaque scares me, because this bacteria doesn't just stay on the tooth. The whole body has to deal with this bacteria. The liver, the heart, the kidney has to deal with all of this bacteria and all of the toxins and the junk that they produce. So when looking at dental health, dental disease, some people feel overwhelmed. They don't even know where to start. And the first thing I'll say is talk to me. Talk to your veterinarian. Don't try to go at this alone, because there are so many things out there that you can do, and every dog is going to be a little bit different as to what the right first step is. So talk to me. It's best if I can do an oral exam, because then I can see what's going on. Because look at that picture. If I told you to start brushing that dog's teeth, he would not be very happy. That mouth hurts. broken, infected teeth, they're painful, and so starting care is sometimes difficult. Sometimes you have to start with a dental cleaning with tooth removal, tooth extractions, before you can start home care, before you can start really trying to help protect the mouth. So in this slide, we're going to start breaking down what I start to do with teeth. And that's usually dental cleaning is one of the first places we got to start unless we've really caught things early. Cleanings can be done with a patient awake or asleep, and we really try to judge based on level of dental disease, concern about problems we may find under the tartar, and of course, how good is the patient going to be. Cleaning consists of 2 steps. The first is hand scaling. It's going to remove large chunks of plaque, help kind of get the bulk of the stuff out of the way so we can get down to work. Then we start ultrasonic scaling. This removes smaller deposits. Ultrasonic scaling is great at getting into crevices underneath the gum line to help make those teeth cleaner. Here we're going to see some things about ultrasonic cleaning. The ultrasonic cleaning uses vibrations, approximately 42,000 vibrations per second, so super high speed, to break up plaque, to break up that connection to the tooth, because plaque is like cement. I mean, it is stuck to this tooth very well. It can also kill bacteria. Ultrasonic cleaning is something that requires training. It's not something that you just want to do without knowing what you're doing. Because of those high-speed vibrations, you can actually damage enamel. If you don't know what you're doing, you can generate enough heat to actually damage the tooth, to damage that nerve and blood vessel in there. After cleaning is done, we're going to polish those teeth, because in that cleaning process, both with the hand scaling and the ultrasonic scaling, we're going to create little microscopic scratches and abrasions. And if we leave those there, then that's going to remove that natural barrier that smooth enamel is to slowing down tartar buildup. So we've got to remove those abrasions, and that's what polishing does. It's an abrasive paste that smooths that enamel out. People probably have always had their teeth polished after they get back from the dentist. That's that stuff. It feels like grit or like sand in your mouth, and you have to rinse and spit a lot to get that out of your mouth. This part is super important, because without that, we leave that enamel roughened up, and it allows plaque to build up faster. After cleaning is done, after polishing is done, is usually when I'm going to come in, and that's when I'm going to do a dental exam. I'm going to look at all the important structures of the mouth, not just the teeth. We're definitely going to check the teeth out. We're going to look for loose teeth, infected teeth, broken teeth. We're also going to check the gums out. We're going to look for gingivitis. We're going to look for gum loss or gum recession. We're going to also assess for any growths in the mouth. We're going to look at the tongue. We're going to look for sores, again, growths in the mouth. We really want to look at everything in there while we can, because it gives us a great chance to assess how healthy is the mouth. So after I've examined the mouth, that is when dental x-rays come into play. And dental x-rays are super important as part of an oral exam. Now this is one place where a non-anesthetic dental cleaning, I can't take dental x-rays if we're doing a non-anesthetic dental cleaning. And so that's why, again, we'll try to be really careful with who we recommend a non-anesthetic dental cleaning for, or why sometimes after a cleaning, after non-anesthetic cleaning, I may say, we really need to get some x-rays. So we found a tooth where we've got to assess what's going on underneath the gum line. We've got to check out how healthy maybe that pulp chamber is. Dental x-rays can be digital or have film with those x-rays. We have a digital system here, which is great. It takes great high quality x-rays and very fast. What it allows me to look at is the root, the bone, the periodontal ligament, those structures that are underneath the gum tissue that you can't see with an oral exam. In an exam of the mouth, periodontal disease is probably going to be the number one disease that we are going to find if we're going to find dental disease in the mouth. We're going to talk about some of the other ones later, but really we're going to spend a lot of time talking about periodontal disease, because that is the most common thing. That is the thing that we fight with the most. As you see, 90% of dogs are going to have dental disease or periodontal disease, and 70% of cats are going to have periodontal disease that are over the age of 5. So it affects a huge percentage of our pets. Now, in that 90%, 70%, there are different degrees of periodontal disease. But periodontal disease really is why I remove most of the teeth that I remove. Because what happens is bacteria from the plaque, those 10 trillion bacteria, get underneath the gum line. And then those bacteria start to infect the bone. They also start to infect the gum tissue. They destroy the bone, they destroy the periodontal ligament, they destroy the attachment of that tooth, and they cause teeth to get loose, they cause teeth to be painful, they can even turn into a full-blown abscess in there. That bottom picture you can see where you can see actually the root of the tooth. You can see where the bacteria has caused significant periodontal disease such that we have gum recession and bone recession, and now we have lost attachment of that attachment that tooth needs to be healthy. In this slide, we see some examples of periodontal disease on x-rays. This is what I'm really trying to avoid. This is why cleanings are so important, why home care is so important, because if I can prevent or limit periodontal disease, I can save teeth. I can prevent tooth abscesses, I can prevent tooth loss, I can prevent pain. You can see in that top x-ray, that's a periodontal disease that I wouldn't have even found without an x-ray. So it shows why x-ray is so important. And on the bottom right, that's a jaw that broke because of periodontal disease, because there was so much infection, so much destruction of bone that jaw broke. It can even happen while teeth are being removed if teeth are so diseased. It is a terrible thing to happen. That's why we always want to get in there before these things happen, before periodontal disease gets so extensive. So in these next few slides, we're going to start talking about what can we do. The now what. I've done an anesthetized cleaning on your pet. I had to remove 2 teeth that had periodontal disease. Well, how can I start protecting the rest of the teeth in the mouth? And what we got to do is we've got to start doing home care. We can't really just rely on dental cleanings and expect teeth to never have any problems, because within 4 to 6 hours, bacteria and proteins start to collect on the tooth. Now that doesn't mean we have tartar yet, but that's when the process starts all over again, and it starts sticking together, and the bacteria starts growing, and eventually we will end up with tartar back on the teeth. So we need a slow plaque buildup. We need a slow tartar buildup down. We need to prevent periodontal disease. And in the end, that will help us save teeth. So what are some things we can do to care for our teeth? Number 1, brushing, dental chews, mouthwashes, dental diets, and then of course we come back to dental cleanings, because those are going to be needed. Just like us. We can brush twice a day, we can floss. We're still going to have tartar buildup come back. So dental cleaning is also an important part of continued care of a pet's mouth. So we're going to break down our first home care, brushing. Brushing is by far and away the most effective home care that you can do. It is, if I could get everyone to brush their dog's teeth, there will be a lot less dental disease that I have to deal with. It loosens bacteria, it loosens proteins, it gets them off of that enamel. It helps ensure more teeth are treated because you are doing the brushing. You are moving that toothbrush to hit all of the different teeth. You can get into the crevices, you can get up along the gum line. It also gives you a chance to examine their mouth, to see what's going on there, to maybe tell me, oh, I saw a broken tooth, I see a growth in there, before I see them, in 6 months to a year. Their dental chews, their oil rinses, they're very helpful. They again work by abrasion, some by killing bacteria, some both. Whenever you're looking for something, if you're not getting it from me, always look for the VOHC seal of approval. This shows that there is some research behind these products that show they do provide some benefit. Now I have some products that I use that haven't necessarily gone through this approval process, but they come from companies that I trust and companies that I feel like do a good job on creating pet products that are helpful. Special foods, or I like to call them dental diets. This has actually probably become my new favorite thing because compliance is key with anything that we do for their teeth. Something that I can do every day is going to work better than something I do once a week to once a month. And I'm always going to feed my dog at least once a day, hopefully twice a day. Again, that's why they're great, because they're going to constantly have access to this. They work through a couple different mechanisms. Every diet has their own, special, way that they're supposed to work. Science Diet has 2 products that I really like. I carry the Healthy Advantage and the TD. I feed my dog the Healthy Advantage. Purina has one called Dental Health. Royal Canin has one. But again, I love these because they're easy to do. You feed them and you're doing something good for their teeth. Now, the one downside of these dental diets is they don't chew with their front teeth. They don't chew with those canines and with those incisors. So that is a place that tartar buildup can still be an issue, even in dogs that use dental diets. or if that's something that I've really gotten away from. It has some good research behind it. I just found that owners weren't very compliant about using it. Even when I tried it in my dog, it was harder to remember to do something once a week than every day. And he really didn't like having it applied. So I've quit using this. It is still out there. It acts like a sealant. So what it does is it's a wax that after we clean their teeth, we apply this wax that the bacteria and the proteins then stick to. And this wax is worn off during normal chewing. So then the bacteria and the proteins go with it. And then this wax is reapplied weekly. In these next couple slides, we're going to start looking at some other dental diseases, other oral diseases that we see in pets. So this first one is something called resorptive lesions. More common in cats than in dogs. Both animals can have it. And this is a disease where the enamel and the dent are destroyed, exposing the sensitive pulp cavity. Kind of like a cavity in a person, in that it exposes those sensitive structures, but in us, cavities start from the outside and work their way in. Resorptive lesions start from the inside, underneath the gum line, and work themselves out. We really have no treatment for this other than removing the damaged tooth. So whenever we find one of these, if it's below the gum line, it's not painful because there's no sensitive structures that are exposed to the outside world. But once we see those sensitive structures, like on this picture on the left, you can see that red irritated area of the tooth. Well, that's where there's no more enamel and that pulp cavity is just exposed and sore and bleeding. On the x-ray there on the right, you can see how that tooth is less dense there, and that's an x-ray of course the tooth on the left. And so you can see how the enamel's missing. It's just been eaten away by the body. So what we do is we actually remove the crown of the tooth and cover the sensitive structures with the gum tissue, and then the body actually finishes that process off. With oral tumors, again, something we're looking at in an oral exam. Do we see masses? Do we see growths? Not all growths, not all masses in the mouth are tumors, but it's one more thing we're always on the lookout for. Of course, dogs and cats can both be affected by oral tumors. Dogs more common. They can range from, they can be epiluses, hyperplasia, fibrosarcoma, squamous cell carcinoma. These can be benign or very aggressive. They can be malignant. And this is why biopsy is so key with these things, because it can sometimes be really hard to tell the difference. And so we have to usually get a piece of these things so that we know what we're dealing with. In this slide here, I've got pictures of different types of oral masses. And the question that I pose is, which one is cancer? And we really can't tell sometimes by looking at it, which is why biopsy is so important. We've got to get a piece of this and get it into the lab and find out, do I just need to take the growth off? Or in some of these tumors, we have to take jawbone, multiple teeth to try to keep them from coming back, to keep them from spreading to other parts of the body. The final disease that we're going to talk about is feline stomatitis. Feline stomatitis is a condition only seen in cats. It is a severe inflammation of the gums in the oral cavity. This disease is extremely painful, extremely painful. These cats come in, they can hardly close their mouth, they're drooling, sometimes they've stopped eating, their mouths have a really bad smell. The frustrating thing about this is the cause is very unclear, so we don't really know exactly what we're treating or what's causing it in all cases. We think that in the majority of these, it's some sort of hypersensitivity, some sort of overactive immune response to the bacteria in the mouth. Treatment varies. Sometimes antibiotics are used, sometimes steroids are used because steroids suppress the immune system and control that reaction. Whole mouth extractions is a very common thing to do to try to get rid of where the bacteria are growing. Sometimes in that situation that doesn't work and we still are left reaching with things to try to suppress the immune system. I've euthanized cats over this because this is a really bad disease and sometimes a frustrating disease to treat. And unfortunately we don't know enough about it to know how can we prevent this disease. So that's it for my lecture tonight. Hope y'all all enjoyed learning about dental disease, about what we can do for their teeth, a little bit about the anatomy. I am going to have a video on our YouTube channel soon about how to brush pets' teeth. So definitely check that out and learn how to brush your pet's teeth. both cats and dogs' teeth can be brushed. Usually dogs are a little bit more cooperative. So again, thank you everyone for tuning in. I'm excited to do more of these and look forward to input as to what things y'all would like to learn about.